Welcome back to another podcast of Heal Without Harm. My name is Dr. Clayton Dir, physical therapist, and here to bring you the no-nonsense info about the medical world. And today the topic is going to be instrument-assisted soft tissue manipulation. You've probably seen people using those metal tools, scraping across someone's skin on TikTok, Instagram, Facebook, what have you. And they usually get left with crazy gnarly bruises. The person is just going back and forth over and over and over again. And the lie that is, maybe it's not a lie, but the information usually sold is that it's breaking up scar tissue. And ultimately, it's the first question everyone asks when we get down to it. And I will debunk that a little bit later in the podcast today, but it's not really doing that is the short of it. Let's talk about what's really happening with instrument-assisted soft tissue manipulation. I'm just going to call it iASTM, and why it might help you feel and move better. Ultimately, what we will do is use stainless steel or a plastic tool to apply controlled pressure over the skin and the soft tissue. I was actually working on someone once, and they said, "Oh, you mean coining?" And they were Vietnamese, and I guess in their culture, and what they would use is tiger balm. And anytime they would get sick, their parent would throw a bunch of tiger balm on their back, usually around the rib cage, and they would take coins and scrape along each rib, and it would induce this massive inflammatory response, which is the first step of healing, which is actually a really good thing, and would help them get over their sicknesses quicker. That's, from what I've been told, that's the earliest that I've heard of this taking place, and it goes back generations. You also have gua sha, which is usually the use of animal bones to scrape across the skin to try to treat musculoskeletal issues. But in more modern day, in particular, you will hear it called ASTYM, which is ASTYM. It's just a branded name. Or Graston, they use the metal tools that looks like chrome. I've also seen hawk grips or RockBlades. There's all different kinds of these things, but ultimately, whenever you're having pain in an area, especially a broad area, think about your entire forearm, your entire low back, the entire quad, stuff like that. We can throw some coconut oil or cocoa butter on the area, and we will scrape up and down. Usually we'll go down 3 or 4 times across an entire muscle belly, and then we'll go up 3 or 4 times. Usually the whole process takes anywhere from 4 to 8 minutes, depending on the size of the area that we're treating and kind of how much that patient can tolerate in regards of the tenderness in the area. But what we'll do is we'll scrape across that. You will see the whole area turn bright pink, right? Just like if you were to rub your skin for a little bit. The cool thing, though, is you can treat an area the size of your quad, that entire upper thigh. And what we will notice is we will actually see bruising start to take place. The fancy word is called petechiae. It's like this little speckled red. It'll usually only pop up in the area the person is actually having pain, which I think is really cool. I'll tell you a patient story here in a little bit. Anyway, we will treat multiple different areas: calves, hamstrings, forearms, neck, shoulders, shoulder blade, low back. It's really good for tendon pain, stiffness in an area, or tight muscles. We'll also use it in cahoots with dry needling or cupping and things like that. Let's get down to the science of it. Hopefully I'll keep this actually somewhat interesting. Ultimately, it stimulates mechanoreceptors, which is ultimately the little nerves that control how tight things are in an area. They're detecting tension in the area. It's stimulating those so that they'll actually allow you to get more range of motion in that area. So maybe you're scraping the quad to help you with knee flexion or knee bending. You're scraping the top part of your shoulder to improve neck range of motion so you can actually check your blind spot when driving. It'll also increase blood flow into the area, which ultimately reduces pain sensitivity. It makes you less sensitive to pain. Helps reset muscle tone and tissue glide. This is the one that I think more information and more research is going to be coming out in the next 5 to 10 years, because I think it really affects the fascial system. We just don't know how yet. But the bright side is we don't need to know how, because ultimately, if you come in pain and I scrape over and you walk out in pain, we got the result. We're just unsure exactly how it affects the fascial system. The next one is improves movement quality. Of course, if you feel less pain, you can move better. It enhances muscle engagement post-treatment, so you can actually usually recruit muscles a little bit better. Again, secondary to less pain. And it only really works if you use it in combination with movement and strength work. Just like dry needling, if you listened to that podcast a couple months ago, we can do this treatment and we can decrease your pain temporarily over and over and over again. But if you're not taking advantage of what we call the therapeutic window, you're never going to get long-term results. What the therapeutic window is, if you come in and you have pain, we know that the body generally does a great job of healing an injury, healing an area. But if the main reason that it's not healing after a matter of months or years is because you can't handle strengthening, this is where iASTM or something like it can come into play and decrease your pain for a temporary amount of time, aka opening up a therapeutic window that you can go do the exercises that are actually going to help you, but you can do them without pain now. You put those two in combination and you will actually start to get the results you've been looking for. Here's some things that iASTM does not do. Remember earlier, I mentioned scar tissue. One thing that was told as early as 5 to 10 years ago, and actually probably still to this day, is that these scraping tools, these plastic tools that you can buy on Amazon for $5 or $10 are breaking up scar tissue in an area. You are not breaking up anything in this area with a tool. Your body's not a steak that you can tenderize. You are not going to do that. They've done studies on fascia and scar tissue, and it takes ultimately cutting with a scalpel, or an insanely high amount of force to break up scar tissue. And I think it ultimately comes from the fact that some people are told that they are in pain because of scar tissue, and most of the time that is not the case. So it is not breaking up scar tissue. The other one is what I already alluded to before, is it does not work in isolation. If I just scrape you and you come back next week, probably the pain's going to be back to the same. But if I scrape you and then we start working on exercising or stretching or mobilization, then you finally start to get the results. You go back and forth between the two. 3-4 weeks in, you're crushing it. You're out of pain. You're moving like you want. You're strong like you want. And we keep going from there. It's not a miracle cure or a standalone fix for sure. Who it's best for? A lot of times we say athletes, right? The people who move a bunch, they have overuse injuries, tendinopathies, tendonitis, those types of things. But it also works great for desk workers with neck and back stiffness, post-op patients as part of a full rehab program, but only introduced when it's ready, usually 8 to 12 weeks in at a minimum amount of time. But as they're going through that whole rehab process, we'll use it on and off. And ultimately, anybody who's in pain and just needs to move better. A couple of stories here. My wife is very needle phobic. She does not like to get poked with dry needles or needles of any sort for that matter. And she responds fantastic to iASTM. She responds fantastic to scraping. Anytime she's having a headache, usually it takes me 4 or 5 minutes, throw some cocoa butter on the neck and shoulders, and I will scrape from the base of the skull, so right up where the neck meets the skull, and down to the tip of the shoulder on both sides, and kind of create a diamond shape on her back. And we'll scrape through those areas. And most of the time, I actually just asked her before this, she said the best thing that she could say is it just relieves the tension. She also said it's warm in the area and it brings blood flow and kind of like makes her feel like she just had a massage in the area. Ultimately, I usually describe to people it's like an express deep tissue massage where it may hurt a little bit during, but it's usually not that bad. And then afterwards, you feel phenomenal. The other real world example that I'll give you, most of the time, for me and my practice in particular, dry needling is a staple. Dry needling is where I get most of my quick results with people and get the buy-in so that they can start doing the strengthening and the exercises they need to do. However, there's certain injuries that just you can't poke it. It's a vague pain. It's in an area that there's sensitive structures that you cannot dry needle. This is the one getting into the patient that came in. She had pain just below her shoulder blade on the back. So if you know where the bottom kind of inferior angle or the bottom corner of your shoulder blade is, her pain was like an inch or two below that. Like we're not going to dry needle that area. There is very little amount of tissue there before we hit lungs, and so we're not going to dry needle it. It was also vague and hard to locate for her. Like every time I'd point in that area, she said it's somewhere around there. And what we did is, after we ruled a bunch of stuff out, the treatment that we chose was the scraping. We scraped across that area, and we probably scraped about 2 like full-size hand amounts of surface area on her back, and she had 2 or 3 lines of bruising right along those ribs where she was pointing to the pain. And so we scraped a whole huge area, and there's only 2 lines that actually bruised up, and that was right where she was having her pain. And then the next week when we saw her again, first of all, her pain was like 80% better is what she reported. But the other thing too is when we scraped it again, the bruising that took place was less than 10% in regards of severity and surface area size. And so it was incredibly shrunk down. And then visit 3, it was gone and she was out of pain. So it's almost used diagnostically. Of course, we can't diagnose anything with a treatment necessarily, but it helps us locate what tissues are particularly having trouble healing. Now, like I said, ASTYM is something, or iASTM is something that could be fantastic, but ultimately it is not a solve-all. It is something that works fantastic in conjunction with strengthening, mobilization, and a full rehab plan. It helps calm down the irritated tissue, improve mobility, and make strength work much more effective. But it's not about scraping things apart. We're not breaking down scar tissue at all. So please, if you don't mind, invite listeners to reach out and come on in and try it. If you've had it done in particular, maybe you share this with them because you had no idea how to describe it. And ultimately, this dry needling, and I'll do some episodes of our cupping, are just one of many tools that we'll use in a rehab plan of care. If you liked this and you want to learn a little bit more how to heal without harm, or if you want your friends and family to learn a little bit more how to heal without harm, please share this episode, share it to your story, tag me in it, and I will share it back. And thank you again for listening, and I hope today you learned a little bit more on how to heal without harm. Thank you.